Multimorbidity is living with two or more health conditions at the same time. And those can be physical health conditions, such as diabetes or heart disease, or mental health conditions such as depression. Multimorbidity is a growing problem for health services and places a considerable burden on the care system. And by funding improved research for multimorbidity, we can develop better treatments, better ways of caring for people, and this in turn improves the quality of care that patients receive, the outcomes that patients experience, and reduces costs for the health service as well.
LINC stands for Lifespan Multimorbidity Research Collaborative. LINC comprises a large team of investigators as well as clinicians. LINC is also very fortunate to have on board a highly active group of people with lived experiences of multimorbidity.
I think it's important to include people with lived experience because the research is actually being done about them.
I need to use that experience that my family has had with their health and communicate that to researchers so they can look at, why are there health inequalities, what can be done about that.
Psychiatric diagnoses, type 2 diabetes, and the tablet box is like this. So remembering medication is quite, because I've got cognitive issues from mental health and neurodivergence.
Being a carer with someone who's got lots of long-term health conditions can feel like you're just having to juggle lots of balls, I would say. So you're having to be the sort of the link between all the different doctors and the different sort of services. I think for carers and for patients, the benefits of doing all the work and the research into the long-term health conditions is that I think if people can understand better about what their different health conditions are, what their health needs are, they can be a bit more kind of empowered.
Now we know that people with internalizing conditions are at high risk to later on develop cardiometabolic conditions. And we also know that people with cardiometabolic conditions are at increased risk of later developing internalizing conditions. But we don't very well understand why that is the case. What is getting increasingly clear, however, is that the seeds for the development of this type of multimorbidity are planted very early in life. One of the main aims of LINC is to better understand why some young people are at greater risk of later developing multimorbidity than other young people. The aspects that make LINC unique are we are studying the development of multimorbidity from early childhood all the way into old age. Most of the studies that have to date been conducted with regards to health have been conducted in individuals of European ancestry. So LINC is also very keen to better understand why certain ethnic groups have a higher risk of multimorbidity than other ethnic groups. Being
a father, being a carer, sometimes you can see things that we see from like culture's point of view, like the social economic point of view where the researchers might not see it.
Caring for somebody who's got multimorbidity, because my mum doesn't speak English and her language is Urdu, it means that everything that the GP or the consultant is communicating about a health condition, it's me translating that for her and explaining that in detail. And sometimes you don't have that terminology in our language. Our insights into the differences between subgroups into society can lead to more tailored health messages targeting specific groups. And those health messages should be more effective than those that are based on a one-size-fits-all approach. Knowledge is quite a powerful thing. Had my mum originally had that information and she'd known that, okay, this is hereditary in my family, she could have then sort of managed her lifestyle and her behaviour. I haven't got it, but I may be at risk of it. So it's another point for me to think, okay, I need to change my behaviours as well. So the whole project that we're doing, it's about how do you get that message to the younger generation, because you want to break that cycle.
What I'm really hoping, and why I got involved, is from the adverse childhood experiences perspective in particular. So my interest is getting in there earlier and listening as soon as problems appear. so that when that 7-year-old is 60, they're not in the same position I'm in.
Our findings with regards to early life factors will help with the development of new approaches where we can reduce the risk early in life and hopefully prevent or at least reduce the development of multimorbidity down the line.